Thanks, Erica.
Yeah.
Well, I got to say it's pretty exciting to be at the table and to be working on a lot of this and seeing every year we kind of run through this annual accomplishments, and it's really pretty exciting to see the work that's been done and the things that we've accomplished, because things move on and you kind of lose track of some of it. But it really builds upon each other and the activities that are done, and it's really exciting to see that. And although we're the ones up here talking about it, the reality is it's because of all of you, and it's the work that we've come together to do and develop, and it's really exciting to see the end results. And now I'm in control.
Push it there.
Just that one button. Don't
Just
touch
don't
anything
touch anything else.
All right. So that's exciting. And Erica, thank you for putting that presentation together, because it really showed some really great work, which kind of leads us to where we're at now. And we have been active as a healthcare coalition since about 2007. We've actually been active in this arena since about 2004, when the first national disaster started happening and the federal government decided that we need to enhance the healthcare system to respond to large-scale events. The issue started in 2004 trying to enhance hospital preparedness and public health preparedness. And really the onus was, back in those days, we had a hospital planning committee, which consisted of hospitals. We had public health, regional public health activity that consisted of local health agencies. And we did a lot of work trying to enhance our capacities around communicable disease and hospital response. But it didn't take long to learn the same stories that you folks in healthcare really realized a long time ago, is healthcare isn't border-centric. We don't have jurisdictions. You don't have county boundaries that you work in. Healthcare is regional. Healthcare is statewide. It's national. So it became very apparent at that time that we really need to look at how do we enhance our healthcare system to respond, and how do we better integrate those systems so that they can respond together when you're looking at mass casualties, when you're looking at patient transports, when you're looking at getting patients to the appropriate level of care in the most efficient manner. We need to do it as a team, not as individual hospitals and individual local health jurisdictions. So we started a transition, and a lot of this work, as you can imagine, was grant supported back in the day. It was grant deliverable driven, so a lot of the work that we did at that time was trying to meet a grant deliverable, write a plan because that was the grant deliverable, write a look at our burn capacity because that was the grant deliverable. And as we continued to work down that process and that path, it didn't take us in Region 9 to realize that we're achieving our grant deliverables, but are we really enhancing the healthcare system? So how long have you been here? 4 years? About 5 years ago, we started to think we really need to get beyond grant deliverables and really start to enhance our system. So our region put together a plan, and we hired a regional planner to help us do that. And so we started to look at what does our regional healthcare system need on top of those grant deliverables. And Erica has really led the ship down this path to get us to where we're at now, of starting to make that transition to say, what does our healthcare system need? How do we coordinate? How do we respond? And where do we need to go with that? Then you throw on top the latest issue that comes out, and that is funding. Another major driver we have right now is funding. To be quite honest, the federal government is looking at their budgets. They're looking at reductions. And this program that funds this activity, the ASPR program, is starting to see funding reductions, which is what supports our work. So as we look at that, we start to realize that if we want this work to continue, we need to develop a sustainable plan to keep this work moving forward into the future. If we as a community want to be able to work together, then we as a community are going to have to figure out how to make that happen. And the path that we were on wasn't leading us in that direction. So we kind of started to steer the ship in a different direction and really start to figure out where do we need to be as a healthcare coalition so that we're sustainable and we're in a position where we're providing what the services that our healthcare system needs, and we're ready to move into the future with a sustainable model. So in order to do that, we started looking at our strategic planning processes. And we started to, we put together a process based on our experiences at the Healthcare Coalition National Conference with the National Healthcare Coalition Resource Center, which is a group of coalitions that have come together who have already been where we're at now. They have gone through the strategic planning process. They have experience in how to get from here or how to get from there to where they are now. And so we really tapped into their experience and their guidance to help us get from where we are now to where we need to be in the future. So on June 10th, we pulled together a strategic planning workshop. We had 38 participants from 28 different organizations from throughout our region. And I really got to say that is just phenomenal to be able to pull that many people together, that many different organizations for a day-long strategic planning workshop, because, my God, there's nothing more boring. I'm sure you've been there. But it was really actually a pretty exciting conversation, and it's really exciting to hear our partners when they talk about the work that they do and the work that we do and how it all works together. So we went through an 8-hour guided, facilitated workshop with exercises, goal setting, and to really define what are we, how do we get from here to there. We went through that workshop. They took all that information back, and in August they gave us a report. And this is their report for our region. And that's kind of what we're going to talk about. This report contains 9 recommendations and some goals, some short-term goals, some long-term goals, and some things that they have recommended that we pursue and that we use to move forward and guide us to where we need to be. So we have looked at this on several occasions with different groups, and we're just kind of going to give you guys an update of where we're at. The Executive Council has talked about this, the Healthcare Coalition Executive Council. Talked about the goals. We have brought this back to the work group. We held a work group session on Monday to look at where we're at, where we're going, what do the recommendations mean, are they sound, are they valid, and do we want to pursue them? And so we've done that, and this is kind of where we're at. In this report, there's a list of short-term goals, things that we need to work on. And I have to get my big copy because as I look at her picture, I'm moving down into the greener pastures, and I can't see like I used to, so I need the big print. So as we look at our clarity on our current strengths, structure, and values, one of the things that we keep hearing is, what is our structure? How are we organized? How do we make decisions? How do we as a coalition function? So we're really trying to look at what is our formalized structure? Where do we need to be so that we as a coalition can move forward in a unified, organized manner? So we're really starting to look at that, and we've got some tools that we're developing to do that. We're really starting to work on a charter, something that our partners can sign that really validates and identifies what the coalition's goals and responsibilities are and what our partners' responsibilities are to really help us define that. We've developed a mission statement, and right now I'm going to read the mission statement. To prepare for, respond to, and recover from crises using all available resources to provide patient care at the appropriate level and in the most efficient manner. So if you remember anything today, remember that, because that's what the test is to get you out the door after the meeting. So we're really starting to look at what is our structure. How do we build our structure so that we're better prepared to move into the future? We need to include the right people. Those that were in the workshop, we really started to define stakeholders and partners. Stakeholders are really the critical elements of the healthcare coalition. If you want to look at that, probably your stakeholders are going to be your hospitals. They are the base, the foundation of our healthcare system. And there's others that build into that stakeholder model. And then we have our partners. Our partners are important. They're just as important, but they're not the critical elements. They're more of a supportive structure. They're who we can rely on for resources, or who can rely on us for resources. So we're really starting to define who those stakeholders are, who those partners are, and how do we engage everybody at the appropriate level. We need to develop a business plan. We really need to be clear of what our business plan is, what our goals are, what our mission is, what our structure is, and how we are going to move forward to build a sustainable, resilient healthcare system. And as part of that business plan, we have to figure out how are we going to fund that business plan. Because as we're looking into the future, federal funds are going to start to be reduced, and at some point probably are going to be non-existent. So if we want to have a sustainable operation, we need to figure out how to pay for it. So that's another driver. We need to work with our partners to define what our operational role is. Right now, we've been a planning assistance organization. I think we get together, we facilitate, we write plans. We help you write your plan. We coordinate planning. But does the coalition have a more involved role in a large-scale incident around operational structure? And what is that structure that hospitals and the healthcare system needs us to play so that we as a system can respond? Some of our mid-range goals. we really need to take that business plan and that financial plan and meet with our key leaders and our new stakeholders. We need to let people know what we are and what we're doing and how we're going to do it in the future, so that they can decide how much of a partner, how much of a player they want to be in our organization. So that's another critical step that we're moving towards. Again, we need to look at what is our operational response plan. We need to develop that plan. That's kind of multi-level, is how do we as a healthcare system operate, and how does the healthcare coalition support that? So that is another midterm goal. One of the things Erica referenced, and you see in her presentation, a lot of things that we do are around exercise, training, and education. We feel that that's a very, very valid and important aspect to be bringing is some good, credible education. And one of the things that we've really tried to capitalize on, as Erica said, is what are the lessons learned that people have? Part of the problem that we have in our region, which is a very lucky problem to have, is we don't see a lot of large-scale disasters. We haven't experienced a response at the level that we're talking, which is great. But what that does is that leaves us into a level of self-denial. We don't need to, because we're not going to have earthquakes. We're not going to have hurricanes. We don't have tornadoes very often, but we do have small tornadoes. So we live in a world of thinking this isn't going to happen to us. Well, you're going to hear shortly a presentation from Snohomish County where something very easily can happen, and we need to prepare for that. So we're going to continue with our education and exercise planning. New relationships. We need to continue to build out to new relationships with our partners. We have a whole bunch of healthcare partners out there that we haven't even knocked on the door yet. So it's great to see the new folks here. Please make sure you keep in touch with us so that we're meeting your needs at the same time. Some of our long-term goals, obviously, we've got a few years where funding is marginal, but if we want to continue on, we have to look at our funding options. So we're going to start having conversations about what are long-term funding options to support a healthcare coalition. And there's a whole gamut of possibilities there, and we're going to have those discussions, and we really appreciate your feedback and your input as we continue to have those discussions, because obviously if we're going to continue a healthcare coalition into the long-term future, funding is going to be an issue that we have to address. We need to stay relevant to our new partners. We need to stay relevant to our old partners. We need to make sure that our healthcare coalition is meeting the needs of our partners in general. So we're going to continue to do that, and that really is where we have to rely on you for your input and your feedback on the things that we're doing, the presentations that we're sharing, the planning that we're coming together on to make sure that it's meeting your needs. A long-term goal is as we continue these discussions, we're going to have to shift into a new governance structure in our healthcare coalition that is a sustainable model supported by our partners. And so that's going to be an ongoing conversations about what that structure might be, but it has to support the sustainable work. So that's just like a really, really quick rundown on the discussions that have taken place as a result of the strategic planning process that we're in.